Investing in Health, Part 18, Kala Vichar or Time Factor, Ahara Vidhi Visheshayatana, Vaidya Dilip Gadgil, Pune. So I was talking about the region and how Ayurveda differentiates between regions. In the same manner, there is a concept of time factor as such. Now, time factor is a common factor for everybody in the world. This is divided into two. One is Nityaga and another is Avastika. So Nityaga Kal is that which keeps on moving ahead, forward. Second, minutes, hours, and then days and nights, and maybe a week, a fortnight, a month, 2 months make a season, and 3 seasons make one ayana, Dakshinayana or Uttarayana, and 2 ayana make a year. So, accordingly, in this Nityaga Kala, there are changes in the body as per in tune with the changes in the nature. Particularly, the changes in the dosha are more important for us. So, as per season, the dosha may start accumulating, which is called as sanchaya, and then they become vitiated, they become prakupita, and again they start coming down to their normals. Say for example, in winter season there is accumulation of kapha in the body. In spring season the kapha gets expressed more and can create diseases. So they mention to have nasya, putting medicine in nostrils, and vamana, a kind of process of vomiting, to expel out the excessive kapha from the body. And then the diet and behavior, etc., has to be in tune with the nature, so that will be pacifying the kapha dosha that one has to see. In the same manner, the vata dosha starts accumulating by the end of the summer season, and in rainy season it gets vitiated, it starts producing varieties of diseases. So Basti treatment has been advocated in rainy season to take care of this increased vata dosha. Pitta starts accumulating in this rainy season and then gets expressed in the autumn and produces varieties of diseases. So they advise Raktamokshana and Virechana, bloodletting, and Virechana is giving purgation and to produce loose motion, so that the excess pitta goes out of the body. So for pitta dosha, this Raktamokshana and Virechana have been advocated as treatments. So accordingly, one has to follow the time factor and see what is proper at a particular time or not. The other variety of Kala is Avastika Kala. So these are varieties of situations, conditions, wherein there are changes, and then one has to consider them and then see the use. Say for example, if I have unripe mango, then it's more astringent in taste, then it becomes more sour, then sour and sweet, and then ultimately sweet. So these changes are brought about by the Kala factor or time factor in the mango. In the same manner, there can be conditions of diseases. In the primary stage of jvara or fever, it's called as there is Samavastha of the jvara. The treatment is London Pachan mainly. The next phase is Pachamana Avastha, when the doshas they start getting digested, and initially there might be rise in the temperature, but it comes down immediately. And the Pakvavastha or Jirnavastha, there is a total different treatment, particularly for jvara. The same principle applies to abscesses anywhere in the body, and the proper condition has to be understood, and then plan treatment accordingly. So In Avastika Kala, one has to consider the varieties of situations and decide whether this will be good for him or her or not, particularly in this situation, etc. And if you do it properly, then you can proceed ahead with very good success, and many people are doing it like that. So we'll talk about the next factor next time. Namaste.